Hello everyone. Today I am extremely excited because this question paper which was uploaded on 17th of October consists of multiple questions out of Gynae and Obs. I am Dr. Apeksha Sharma, your mentor for Gynae and Obs for NextSaviours. Out of this paper, we are going to have a discussion on the question number 16. A 26-year-old woman on combined oral contraceptive pills for the last 1 year. As students, as you know, that combined oral contraceptive, it contains ethinyl estradiol, that is estrogen, and progesterone. So here we are having a 26-year-old woman on combined oral contraceptive pills for the last 1 year. She develops tonsillitis and takes ampicillin for 5 days. Now 2 weeks later, she misses her period and her pregnancy test comes out to be positive. Which of the following best explains the possibility of this contraceptive failure? What the examiner is testing is whether you understand that how estrogen is metabolized and recycled in the body, and how the antibiotics, they interfere with the metabolism. So don't jump at the enzyme induction as a mechanism which is usually seen in case of rifampicin, where here during explanation of the answer we have to understand and decode that how the oral contraceptive pills are getting metabolized in the human body. You see, the estrogen or the ethinyl estradiol is absorbed from the intestine and through the pathway goes into the liver. Here in the liver, the estrogen is metabolized or is conjugated with glucuronic acid or sulfate in order to make it water soluble for the purpose of its excretion. Now these conjugated inactive forms are secreted into the bile, and from the bile it goes all the way into the intestines. Now what is the role of this gut flora? Now here the intestinal bacteria, that is beta-glucuronidase enzyme, is responsible for deconjugation of the estrogen, thereby restoring it into its active form. And this active estrogen is reabsorbed back into the total circulation, maintaining a steady plasma level. You know, this recycling, it is responsible for contributing around 30 to 40% of circulating estrogen levels in OCP users. Now what happens? If the ampicillin is given, it is responsible for killing the gut bacteria, including those that produce beta-glucuronidase enzymes, as a result of which there will be no deconjugation. So the conjugated estrogen, it stays inactive, and the inactive estrogen is excreted instead of getting reabsorbed, as a result of which the plasma estrogen level, it drops significantly. And this negative feedback on the pituitary is responsible for, now this negative feedback on the pituitary gland, it weakens, as a result of which the ovulation happens. So I hope you have understood that how the gut flora is particularly responsible for the maintenance of the enterohepatic circulation or the metabolism of the estrogen and continue it in the body in its active form. Like option number A, ampicillin decreases the plasma estrogen by hepatic enzyme induction. You know, ampicillin does not induce the hepatic enzymes. Drugs like rifampicin, phenytoin, carbamazepine, phenobarbital. So these are the drugs which are responsible for affecting the hepatic enzyme induction and not the ampicillin. If we look at the option number C, that ampicillin is responsible for accelerating the metabolism of progesterone, it is again wrong, because ampicillin is responsible for affecting the gut flora, as we have just now seen, not affecting the hepatic metabolism of the progesterone. Is it because of the missed pills? There is no evidence of the missed pills provided to you in the question, as a result of which it can be easily ruled out. So the answer we are left with is that ampicillin is responsible for decreasing the enterohepatic circulation of the active estrogen, because it affects the enzyme which are responsible for deconjugation of the estrogen. So I hope you have understood that how these questions or these type of the questions are to be answered correctly.